So I work at Kenyatta National Hospital Surgery Division, and I'm happy to present the impact of GRASPIT in our Kenyan hospital. So GRASPIT is an acronym, and it stands for Global Recognition and Assessment of the Sick Patient and Initial Treatment. And these were my co-investigators. I have no conflict to declare. That is my outline. And so GRASPIT stands for Global Recognition and Assessment of the Sick Patient and Initial Treatment, and it is a course that was developed in 2010 between the Kenyan government, Ministry of Health, and also the UK government. So GRASPIT harnesses a few principles that we'll be looking at as we proceed on. Some of them I've already written there. It covers the adult patient, it also covers the child, and it was accredited by the National Resuscitation Council in 2013. And by the time we did this research, we had already trained 10 institutions, most of them government institutions. And we had also developed a TOT course, Trainer of Trainers course, so that the institutions themselves, once the training was taken to them, they were able to run with it. Is it easy to spot a sick patient? Is it easy for a nurse? How do we do it? How do we do it? How do we spot? How are we able to diagnose that this patient is not doing well? So that is why we are here. You can hear different whispers, probably not heading the same direction, but it's easy for a nurse who is doing what they were trained and doing what we have learned since yesterday and this morning. They are able to spot an easy patient. This is one of the items that helps us to spot and to diagnose that this patient is not doing well. And what was the problem statement? All of us, point number one, there was poor monitoring of vital signs and especially respiration. Respiration, most people were chatting. They were not actually counting it. And number two, all of us, there were abnormality in the airway, breathing, circulation, and they were not easily recognized whether they were derailed or not. And then most people were not acting on clear signs of deterioration. There was failure to also use a systematic approach when dealing with a critically patient. There was poor teamwork, there was poor communication, and the patients were being referred late. So GRASPIT was developed, like I said, between the Ministry of Health and the UK government. And it is based on 3 principles, and these principles are early detection, systematic approach, minimal use of minimal equipment, and we realized by using those that systematic approach, we were able to save lives. And just a taste of what GRASPIT is, if you had 100 patients, for example, the last day you worked, and all of them were critically sick, if you did the following, you would save the percentages I'm going to show you. For example, if you did totally nothing, you're likely to save the percentage that you're seeing. If you open the airway using the adjuncts that are so easily available where you are, you can see the percentage increase of the number of patients you're going to save. If there was an issue with circulation or with breathing and you gave oxygen, see the increase that would occur if you did the right thing. If the C had an issue and you gave IV fluids, by accessing that IV line, you can see the percentage increase. What if the patient had an infection, like I'm having an infection today, and you give an antibiotic? See the increase that you're likely to have in terms of survival. If you had an ICU, the last one is an ICU, and you took that patient to ICU, see the little percentage increase you'd have. And therefore, GRASPIT is here to show us that the little things that we do, they help to save more lives than we actually know. And you can see the percentage cost down here of every item that you do. So the objectives were to analyze the outputs, to also compare the impact of GRASPIT in 5 of the hospitals that had been trained, and also to describe the factors that were influencing the success of GRASPIT principles. And I will not labor on the literature. I want to say that this research was done based on the model of Kirkpatrick. And Kirkpatrick does a few things. You can engage with it later during your own time. It wants to know how have the participants reacted to the training that has been given. It also checks on the results in terms of increase of knowledge and skills. Then it also wants to know, these participants that have been trained, has their behavior changed in the workplace? Because we know training is not necessarily equivalent to what we do on a day-to-day basis. And then after that, have the processes, the inputs and the outputs been affected positively following the training? And this is just a summary of the Kirkpatrick model. And it was a cross-sectional study that was done in KNH, Kisumu, Nyeri, Karatina, and which one have I mentioned? Have I left out? Yeah, Kisumu was there. And we were looking at the healthcare workers. And when it came to training GRASPIT, everybody who was a healthcare worker was eligible. So it was a highly triangulated study. And the method is that we used the pre and post training tests. We also did a training evaluation. We looked at the confidence level. We also did a questionnaire at least for every healthcare worker who had been out there practicing 6 weeks after the GRASPIT training. We also had the key informants, we had focus group discussions, and we also had the supervisors of the people that were training giving us an evaluation of what they thought regarding the performance of the people that had been trained. And these are the numbers that we were looking at. Ours was census-based. We just looked at it in totality. And you can see the response rate was quite high for most of them. And these were the demographic findings. You can see our nurses are always majority in the nursing setup. And that is why we are not just a nurse. We are the people. Regarding social-demographic characteristics, we can also see the age group. And kindly do not look at this without taking note. Most of our healthcare workers in this institution and in this country are aging. And therefore we need to mentor, and I'm happy that ECSACONM is doing right that. So we looked at how useful it was, and you can see the rating here. The overall rating is here in terms of usefulness at the work, willingness to train after the GRASPIT training, it was quite high. We also looked at the ability to train and the ability to mentor, and that was the overall score there was 83.1. When you look at the average of them all. We also were looking at its usefulness in the workplace. We looked at the willingness, and you can see the scores. This is the overall score. I suggest you interact with this after this. I hope they will be available in our website. And having said that, may I go to the conclusion. Sorry, I didn't see the warning before. So the conclusion is that GRASPIT outputs, they improved the knowledge, they improved the skills, they also improved our systematic way of approaching our very sick, and the study site found it useful. And therefore we recommend that we take GRASPIT wherever we go and wherever we work. Of course, there are factors that are influencing it, and you all being healthcare workers here, you can see your support supervision is very important. Thank you so much.